You know that pain? The kind that just sticks around and won't quit? It's so frustrating. But what if the answer wasn't another pill or a trip to the surgeon, but just sound? Well, today, we're going to dive deep into something called shock wave therapy, which is a really interesting and surprisingly effective fix for that kind of chronic pain.
I mean, we've all had it, haven't we? That one nagging ache in a spot that just refuses to get better. You rest it, you stretch it, you put ice on it, and still nothing. It's just there. And yeah, it's a super common experience.
I'm talking about stuff like plantar fasciitis, you know, that awful sharp pain in your heel first thing in the morning? Or tennis elbow, where even picking up your coffee feels like a major effort. Or maybe it's that rotator cuff thing, that deep ache in your shoulder that stops you from doing, well, just about everything. These are the kinds of chronic problems that can seriously mess with your day-to-day life.
So, what if I told you there's a way to go after these problems that doesn't involve surgery or needles? That's exactly where shockwave therapy comes into the picture. Now, I know the name sounds a little intense, right? Shockwave? But trust me, it's become a really powerful tool for physiotherapists to basically jumpstart your body's own natural healing.
Okay, so what is this stuff really? The official definition is, well, it's a bit of a mouthful. But the parts you really need to grab onto are high-energy acoustic waves and stimulate tissue repair. At its core, it's pretty simple. We're using sound to get your body to heal itself. Let's break that down even more. Think about it like this. On a chronic injury, your body's healing process has kind of given up. It's stalled out. Shockwave therapy is like hitting a giant reset button. It sends this powerful focus signal right to that spot, and it's basically shouting at your body, hey, we're not done here. Get back to work and fix this.
Right. So the big question is, how on earth does a sound wave heal you? It's not magic, I promise. It's actually this really cool mix of physics and biology. So let's get into the nitty-gritty of how it actually works.
First off, these are not your everyday sound waves. They're special. They have this really unique profile, a super fast, super high pressure pulse. And here's the key thing to remember. It's a mechanical force. So don't think electrical shock, think more like a tiny, super focused little hammer.
And that mechanical force, it's like a triple threat against your chronic pain. It sets off this whole chain reaction of healing inside your tissues. We can really break it down into three main levels: what it does mechanically, what it does biologically, and what it does to your nerves. So first up, the mechanical effects. The sound waves create something called microtrauma. Now I know trauma sounds like a bad word, but in this case, it's a good thing. It's a controlled way to re-injure the area just a tiny bit, which tells your body to restart that whole healing process from scratch. Plus, these waves can literally break up old, stubborn scar tissue and those little calcium deposits that make things so stiff and painful.
Okay, now we go even deeper, down to the cellular level. And honestly, this is where the really cool stuff happens. The shock waves basically tell your cells to release a flood of growth factors. They trigger the formation of new blood vessels, a process called angiogenesis, which brings fresh blood and nutrients to the site. And they ramp up production of collagen, which is literally the stuff your tendons and ligaments are made of.
And last but not least, level 3, the effect on your nerves. The intense pulses can actually overwhelm the nerve endings in the area, which can give you some immediate pain relief right then and there. But what's even more important for the long run is that it helps lower the amount of pain-transmitting chemicals, like this thing called substance P. Less of that means less pain signaling to your brain.
All right, so you should know that there isn't just one type of shockwave therapy. There are actually two main kinds, and your therapist will choose the right one for your specific injury. Knowing the difference is pretty important.
Here's a great way to think about it. You've got focused shockwave therapy, which is like a sniper rifle. It sends one precise, high-energy beam deep down to a very specific spot. This is perfect for deep issues, like plantar fasciitis. Then you have radial shockwave therapy. This one is more like a shotgun. The energy spreads out from the device, covering a wider, more shallow area. It's great for things closer to the surface, like muscle trigger points. Okay, the science is cool and all, but I bet you're wondering, what does this actually feel like? You know, if you're the one getting the treatment. Let's walk through what a session is really like from a patient's point of view.
So in one session, you're going to get somewhere between 1,000 and 3,000 of these little pulses delivered to the spot. I know, that sounds like a huge number, but the whole thing happens really fast.
And the great news is this isn't some treatment that drags on for months. For most of these chronic issues, the whole thing is usually done in just 3 to 6 sessions. They're usually scheduled about a week apart, which gives your body the time it needs to do its healing work in between.
So,
What happens when you go in? Well, it's pretty simple. First, your therapist finds the exact spot they need to work on. Then, they'll put some gel on your skin. It's the same kind of stuff they use for an ultrasound, and that just helps the waves travel better. They place the applicator on the gel, and then they start the machine. They'll always start at a really low intensity and then slowly turn it up based on how you're feeling to find that sweet spot where it's working but not too uncomfortable. The whole zapping part, usually over in 10, maybe 20 minutes, tops.
Okay, so what about after? It's totally normal to feel a bit sore in that area, kind of like you had a good workout. The main thing is you've just kick-started this big healing process, so you need to give your body a chance. The advice is pretty much always, take it easy for the next 48 hours. No heavy lifting or intense workouts.
So, after hearing all that, the big question is this right for you? To figure that out, we really need to look at both sides of the coin. So, let's weigh the pros and cons.
On the plus side, the advantages are pretty huge. It's non-invasive, we're talking no needles, no cutting. You don't need to be put under, the side effects are really minor, and the treatment is over and done with quickly. Now, for the flip side, it can definitely be uncomfortable, even painful while it's happening. And this is crucial, it's not for new injuries. This is a tool for those old, stubborn problems. And finally, it's not something just anyone can do. You really need a skilled therapist who knows what they're doing for it to be effective.
And speaking of downsides, let's just be clear about the side effects. The good news is they're usually really mild and they don't last long. You might see some temporary redness, maybe a little swelling or bruising, and sometimes you might even get a temporary flare-up of your pain before it starts to feel better. That's actually a sign that the healing process has been activated.
So what's the bottom line? What do the experts think? Well, this isn't seen as some fringe experimental thing anymore. It's now considered a powerful, evidence-based treatment. It's really earned its spot as a go-to for helping people with those really difficult chronic conditions, especially the ones that haven't gotten better with other kinds of treatment.
When you step back and look at it, shockwave therapy is it's a really fascinating look at a different way to think about healing. It's not invasive, and it's all about empowering the body to fix itself. And it kind of leaves you with this big question, right? As our technology gets better and better, could this kind of targeted energy, using sound or maybe something else, become one of our main tools for healing in the future? It's definitely something to think about.